is Mark Gunn Media.
Hit it!
Welcome to Gunshots Straight from the Hip. I'm your host, Mark Gunn. The views expressed on this program are those of the host and guests and not necessarily reflective of anyone or any entity associated with this broadcast. This episode, the COVID-19 vaccine and America's history of racism in healthcare. Seems like every day we're getting more and more news about a vaccine for COVID-19 getting closer for distribution. Right now, 6 companies are trying to get approval from the FDA to be able to distribute their vaccine on an emergency basis. And the Trump administration, in a politically cynical move, is trying to put pressure on the FDA, wanting to know why it's taking so long to get those approvals. One of the questions being tackled by the Center for Disease Control in Atlanta is who will get the vaccine first.
The most vulnerable Americans now one step closer to getting a COVID vaccine. An advisory committee to the CDC holding an emergency vote to decide who should be first in line. The group formally recommending healthcare workers and those at nursing homes should be at the top of the list. Together, roughly 24 million people, likely exceeding the number of doses expected to be available at the end of this month, with millions more lining up behind them.
Here's Dr. Anthony Fauci.
As you get into January, February, and March, you will then get the second, third, and fourth level of people who are essential to society.
With early vaccinations in short supply, hospitals are being told to stagger early vaccinations, which would prevent wiping out entire medical units if there's an adverse reaction. The latest guidelines now on their way for approval by the director of the CDC. But ultimately, distribution decisions are up to state leaders. While the recommendations are expected to be followed, they can be adjusted. With 6 vaccine candidates aiming for FDA emergency authorization, the CDC has not yet outlined who should get the following round of doses, but previously suggested next would be those with underlying medical conditions, critical workers like those in the food supply system, and seniors over 65. Most Americans will likely have to wait until spring. It comes as top infectious disease experts look to build public trust in a vaccine developed and set to be delivered at warp speed.
Dr. Bruce Gellin, president of the Sabin Vaccine Institute.
It's that work at a community level that's going to be most important. This has to be clear messaging from the top, if you will, but a huge effort at a grassroots level.
Hope amid the heartbreak as the world moves closer to a vaccine.
One of the hurdles the healthcare industry has to get over is the amount of mistrust on many different levels as it relates to the vaccine. There are those that are worried about the time that it took for the vaccine to come to be in the first place, that it seems a little too quick. Others are cynical about the fact that it's coming out of the Trump administration. And then you have Black Americans whose deep-seated mistrust in the American healthcare system is well-founded and well-documented. David Williams, a professor of public health at Harvard University, explains that there is racism in American healthcare.
Racism is a significant contributor, I think, to it in multiple ways. Some ways in which the racism is obvious to individuals, and many ways in which the racism is not obvious to individuals. So let me give a couple examples. Does their race or ethnicity make a difference in terms of the medical care they received? The report by the IOM released in 2003, it was called Unequal Treatment. And what it documented, it was across virtually every class of medical procedures, from the most simple to the most complex. Blacks and other minorities receive poorer quality care and less intensive care. We were not addressing issues of access. The question was, given access to care, is there a difference in the quality of care received? And we found absolutely there was a striking difference. We did not believe, the Institute of Medicine Committee did not believe, I do not now believe, that the American physicians wake up in the morning and say, how am I going to get my minority patients today? I truly think that most medical doctors go to work, and other healthcare providers, and try to do their best for their patients. If that's true, then there's a conundrum here. How is it possible with people with good intentions seeking to do their best can nonetheless create a pattern of care that is so discriminatory? Our answer was implicit bias. It's also called unconscious or unthinking discrimination. Implicit bias exists among physicians and other healthcare providers, and that implicit bias affects the quality of care they provide to minority patients. What the research shows is that most of us, and this is about not white people, this is about human beings, most of us think that we are driven by our conscious cognitive conditions. In fact, a lot of what we do occurs at a level beyond our conscious awareness and is importantly driven by ideas and narratives and stereotypes that have been deeply embedded in us as part of the culture or the society in which we were raised. There's a lot of research that indicates that in American culture, African Americans, for example, are presented as lazy and dangerous and violent. Those are negative characteristics. Healthcare providers are part of the larger society. Research using the implicit association test, which is one test that tries to get at these unconscious implicit biases, finds that over 70% of all Americans have an anti-black bias. And the number for physicians is also over 70% because they are part of the larger society. We are products of the culture. So it does not reflect then the behavior of bad people. It reflects the behavior of normal Americans who are reflecting the biases and the messages about race that they have received. Importantly, what the research shows is that when we have this negative implicit bias, this negative stereotype, even though we personally are committed to egalitarian principles, without our conscious awareness, when we meet someone who fits that stereotype, we will treat them differently and honestly will be unaware that we did it because there was no intent on our part. And that's why it's called unconscious, unthinking discrimination. It's implicit, it's not explicit. You're not looking at that person and saying, I'm going to discriminate against them. In fact, if I asked you if you did, you'd say I didn't because there was truly no intent.
Another reason for such mistrust, earlier this year, there was a report out of France that a group of doctors wanted to use Africa as the testing ground for the COVID-19 vaccine.
The head of the WHO has condemned suggestions made on air by French scientists that potential coronavirus vaccines should be tested in Africa. Jean-Paul Mira, head of intensive care at the Couchin Hospital in Paris, first asked if he could be provocative before questioning Camille Locht, head of research at the National Institute of Health and Medical Research in Lille, whether a study into using the vaccine should happen in Africa. He compared it to past studies into AIDS that tested treatments on prostitutes. WHO Chief Tedros Adhanom Ghebreyesus was one of many who condemned the tone of the conversation as being racist.
To be honest, I was so appalled, and it was a time when I said, when we needed solidarity, this kind of racist remarks actually would not help. It goes against the solidarity. Africa cannot and will not be a testing ground for any vaccine. We will follow all the rules to test any vaccine or therapeutics all over the world using exactly the same rule. Whether it's in Europe, Africa, or wherever, we will use the same protocol, and if there is a need to be tested elsewhere, to treat human beings the same way, equally. And the hangover from a colonial mentality has to stop. And WHO will not allow this to happen.
Once you break all of that down, the CDC and the World Health Organization still have the task of convincing black folks to take this vaccine. And there are several doctors that understand the reluctance. Jess Caudell is one of them.
Health experts say it'll take vaccines to get back to our old lives. That is, if you'll take them.
I would only trust Dr. Fauci.
If I know it's safe, yes.
I had to see other people taking it.
I don't trust the government.
We heard mixed reaction on that, and Dr. Jennifer Caudell of Rowan University says she's not surprised, especially for the African American community.
There was a study that was recently done that showed that only 14% of African Americans either completely fully or mostly trust that this new COVID vaccine will actually be safe.
But she says the minority community has reason for that mindset.
African Americans have a long history of having been exploited, misused, abused, experimented on throughout the years.
But Dr. Cottle wanted to add she'll be taking the vaccine when approved.
I've heard things like the vaccine will make you sterile or that it will actually give you COVID. Those are not true.
We also spoke with Dr. Ayla Stanford with the Black Doctors COVID-19 Consortium in Philadelphia. She's also a pediatric surgeon.
Every African American isn't saying, I don't want it. And I think we have to dispel that narrative.
She says they've surveyed 600 people locally if they trust the COVID vaccine. They've found that the majority of the African American community needs to see proof it's safe. And they'll have that opportunity with frontline workers set to get it first.
You're going to be able to see them get the first dose, the second dose, be observed for 2 months, and that may be what you need to allow you to want to take it.
Dr. Stanford says one area of caution she has around these COVID vaccines is typically when you test a vaccine, you have a whole 2-year period to see what the side effects are. Clearly, with these vaccines, we don't have that. So she recognizes how people might be cautious and not wanting to take it right off the bat.
You've heard me talk about the historical mistrust that blacks have in the American healthcare system. The biggest example of that being the Tuskegee Experiment. Coming up, you're going to hear from some of the actual survivors of those experiments, and you'll hear from the former Associated Press reporter who blew the whistle on the whole thing. More of Gunshots Straight from the Hip right after this. If you're an advertiser, one of the most important things about getting your message out is actually standing out from the rest of the crowd. If you're listening to this program right now, this is where you'd hear your commercial. As an exclusive sponsor of Gunshots Straight from the Hip, your commercial is professionally produced and gets a longer shelf life based on your needs. Gunshots Straight from the Hip is a unique and compelling program unlike anything else in the marketplace. Episodes are available for download on iTunes, TuneIn, and MarkGunMedia.com. And depending on how you tailor your message, the potential for new and repeat customers is that much greater. Best of all, it's extremely cost-effective. If you'd like more information on how you can be a sponsor of this broadcast, call Mark Gun Media, Inc. at 502-407-0283. That's 502-407-0283. Or log on to markgunmedia.com. For downloads of this and past episodes and information about all the multimedia services we offer, log on to our website at www.markgunmedia.com. That's markgunmedia.com. Welcome back to Gunshots Straight from the Hip. I am Mark Gunn, and in this episode, we're talking about the COVID-19 vaccine and racism in the American healthcare system. We'll take a look at one of the most heinous medical experiments carried out by the U.S. government in history. You'll be hearing from survivors of the Tuskegee Experiment, and you'll also hear from the former Associated Press reporter who blew the whistle on the entire scam. But first, as of this recording, some good news for our friends across the pond.
A monumental breakthrough in the fight against coronavirus. The UK now the first country in the world to approve the Pfizer vaccine, promising to start giving it to people in just a matter of days.
While we've been working night and day to fight the virus and keep it under control, we've been striving to develop the vaccines that can give us hope and let us eventually release the curbs on our freedoms that have bound us for so long.
Vaccines are already on their way from warehouses in Belgium. The country desperate for this promising news as the UK nears the sobering total of 60,000 deaths from the virus.
It's all the more vital that as we celebrate this scientific achievement, we're not carried away with over-optimism or fall into the naive belief that the struggle is over. It's not.
During this first round, the government says 400,000 people will be vaccinated, with the most vulnerable living in care homes and their caregivers getting it first. And they expect millions of doses to be made available before the end of this year. Hospitals are standing by and vaccination centers are being built as the healthcare system says they're preparing for the largest vaccination program in the country's history. The crisis hitting close to home for so many, including the country's health secretary. He stresses how important this vaccine is, saying despite the record-breaking speed with which it was developed, no corners have been cut, even offering to take the shot live on British television to prove it's safe. The government cautions that the vast majority of people will not be vaccinated until the new year, so things like social distancing and mask wearing remain vital. But thanks to this vaccine, there is now a light at the end of the tunnel.
Meanwhile, America waits for approval on the vaccines that it's got in the pipeline, and the COVID-19 numbers are getting much worse every day. Dr. Kavita Patel breaks it all down.
This pandemic is at an alarming point. And, Doctor, I don't know if you're aware, every night for the past several weeks we have, and there's no pride in this, we've been able to come on the air and say the virus is at its peak right now. That's because it breaks every day's previous records. And I'll ask you what I've asked doctors for the past several days. Is it a given in your line of work that what's happening now will lead us to a grim and dark set of circumstances and a potential bump in deaths and hospitalizations just in time for Christmas?
It worries me because we're, as you point out, not just in time for Christmas, but we're getting into a season where I think, critically speaking, we've got healthcare workers. My brothers and sisters are literally giving their lives right now. And I don't know how much more they can take. We're all trying to figure out how to navigate what the next 6 to 10 weeks will look like. And I'm ecstatic that a Biden-elect administration is already getting in the room and getting the planning going. I know what that looks like from the transition from Bush to Obama. And it's a lot of work, but this is not just toppling all records. To be honest with you, this is breaking the backs of the healthcare system that we need to stay open, stay alive, and stay vibrant. And these are the same healthcare workers who are going to be involved in getting the vaccine out. So they are not looking at holidays and loved ones the way we are. They're trying to think about staying alive so that they can make sure they get us through to 2021. And so I just hope people just pause wherever they are, try to do what they can to stay safe. And I mean it, that their lives are on the line, and so are some of my friends who are doing this in hospitals around the country.
While all of this sounds promising, America has yet to deal with its racist legacy in healthcare when it comes to Black Americans. One of the covered-up pieces of American history is that blacks have been guinea pigs for so-called doctors going as far back as slavery. But the most heinous and most widely known example of American cruelty happened in Tuskegee, Alabama, with the Tuskegee Experiment. Here's a look at its painful history from some of the actual survivors of those horrible experiments.
We could no more forget this than we can forget slavery, because it was just an atrocity to reap on any people, especially in these United States.
It was pretty rough. You know that they was involved in something just among the black, you know. Anything like that around, and ain't nothing anybody black, it must be something wrong.
Myself and two of my brothers had to go to the health department and get a blood test. And I had a level of syphilis in my bloodstream.
The Tuskegee study of untreated syphilis in the male Negro. What is the impact of this scientific experiment for the survivors and family members? Coming to grips with what happened continues to be a painful and challenging journey.
Well, I was born in Macon County, Alabama, which is Tuskegee, just about maybe a mile, maybe out of town, you know, kind of south of the town.
George Key, born in 1907, was in the prime of his youth when he became a participant in what is now known as the Tuskegee Study. The program began in the 1920s to document the devastating impact of syphilis. Syphilis was a dreaded disease. Symptoms included severe skin rashes, fever, and pain. To find out more about how the disease affects the body, the Public Health Service initiated a program in Macon County, Alabama, a rural farming community with a high incidence of syphilis. 600 men were recruited for the study. 400 had syphilis. 200 used as a control did not. Nearly all were poor farmers or sharecroppers.
The first time we went, others, 3 or 4 of us went together, and they just some kind of milk, something like milk to swallow, and I don't know what that been so long, I don't even know what that was for.
When the study began, there was no cure for syphilis. Standard treatment consisted of mercury rubs and arsenic injections. Initially, the men in the study received treatments, but with the stock market crash, funds were no longer available and treatments were terminated. However, researchers continued to collect data on the men in the expectation that funding for treatment would become available within 6 months. Ultimately, the 6 months of non-treatment would continue for 40 years, and throughout that period, the men were never told the whole truth.
It was a program they said was helping the people, on it, If they joined that, they could, get some results out of it, some medical care, something like that. And then I was real young then, I was around 20 years old then. I never could understand what it was all about. No more, she said it was a nice program, like colored people when something come around and think you're going to help them, a lot of them would jump into it. We were young, I didn't know what it was all about. Me and my brother both joined in.
After we started going to the hospital, that's where we got involved with the white doctor. He would check me, he checked me and told me what was wrong, but he didn't do nothing for me. He told me I had high blood.
The men in the study received baseline blood workups, physical exams, and at one point, a spinal tap to determine neurological damage. They were told that the spinal tap was a necessary treatment. In truth, it was not only unnecessary, but also painful and dangerous.
That was pretty bad, that spinal tap. Of course, I did along pretty good with it, but I stayed in the bed a week or 2.
By the 1950s, penicillin had become widely accepted as an effective remedy for syphilis. Alabama law mandated penicillin treatment for those infected. However, doctors did not permit the Tuskegee participants to have the new medicine. In their zeal to continue to collect scientific data about the disease, public health physicians withheld treatment from the men. Aggressive efforts were made to discourage the men from joining the military, where inductees were routinely screened and treated for syphilis. Additionally, when some of the men moved away from Tuskegee, the Public Health Service made sure they would not receive treatment. The names of the men were circulated to clinics and health facilities in the cities where they moved, and doctors there were instructed to not administer penicillin. When George Key moved to California and later to Massachusetts, he found that doctors in both places kept track of him. And soon after relocating to Ohio, Ernest Hendon was contacted by a government doctor.
After I went to Cleveland, they still kept in contact with me. Sometime one white man used to come up there and see me about once a year.
The HBO movie Miss Evers' Boys presented a fictitious version of the Tuskegee study. The nurse in the movie, Miss Evers, was patterned after the real Tuskegee nurse, Eunice Rivers.
By frolicking too much, or maybe passed on from your mom and your daddy, you might get a really bad sore down below in your private parts. Then through that sore, a bug can crawl up inside here and go to sleep for 20, 30 years or more, so as not to hurt nobody but you. But when it wake up, you can't walk, you can't breathe, you can't think. That is bad blood. That's what we're checking to see if y'all got, so we can get rid of it.
One reason so many men agreed to participate in the study is because of Nurse Rivers. She lived in Macon County and was a trusted member of the community. The government enlisted her aid in recruiting participants for the study and encouraging them to stay involved. The Public Health Service also asked Tuskegee Institute to help coordinate the study. By using trusted individuals and institutions and by offering incentives such as free life insurance, the government was able to keep participants in the study year after year. In 1972, the secret of the Tuskegee experiment was uncovered. National news articles carried the story of the 40-year medical study that had so wrongly impacted hundreds of men and their families. Congressional hearings were held. There was a major public outcry, and a lawsuit was filed on behalf of the men. One of those descendants recalls how he reacted when he first learned of the study that impacted him so personally. Not only was his father a participant, but also 2 uncles and several cousins.
It was like a bombshell, to have this blow at that time, and then know that my father as well as my uncles were, associated with it. And, of course, I wondered how long that would be privy information,
Herman Shaw, a longtime spokesperson for the survivors and a participant in the study, led a movement to gain compensation beyond money. Many survivors and family members felt strongly that what was needed was an official governmental apology, an acknowledgement of the devastation and deceit that defined the Tuskegee study.
What the United States government did was shameful, and I am sorry.
And just imagine, if this experiment had not been exposed, more than likely it would still be going on today. But thanks to Associated Press reporter Gene Heller, the government was exposed and the experiments stopped.
Everyone who knew about this and didn't blow the whistle, that didn't shout to high heaven, "This is wrong," is culpable.
You don't know a thing about syphilis, except that you got it.
Medical doctors deliberately let them die, wanted them to die for what they could discover from their bodies later. After the story broke and there was this incredible public outcry, Senator Kennedy had held very, very public congressional hearings on this.
If they had been white, your public health service would never have agreed to do this study in the first place. They wouldn't have dared.
The study and the aftermath are well documented in films and books, but there are still things we might never know, and for Heller, that goes back to the very beginning.
I still have not heard the answer to the very simple question of why. They should have been able to determine after the first 3 or 4 autopsies that the inside of a black person ravaged by syphilis looks identical to the insides of a white person, and stop the study.
Beyond that, Heller believes there's no way to know just how many people were directly or adjacently affected by the study or its disclosure. Survivors, victims of the study, and their families did win a $10 million settlement from the U.S. government, and the study's disclosure led to modern medical ethics procedures. But Heller says more than 40 years later, there's still at least one lesson to be learned from the Tuskegee syphilis study.
Those of us who recognize that this country has got so far to go, never quit fighting. Never quit standing up and yelling. I don't care if you're LGBT, I don't care if you're black, I don't care if you're disabled. You need advocates. You need people who can move the world.
So here's the bottom line. As the vaccine makes its way toward distribution over the next few months and more people get vaccinated, America is going to have a really big PR problem to deal with. How do you convince more people that you're working in good faith to keep them safe when you have a repeated history that speaks otherwise? No matter what you decide to do as it relates to the coronavirus vaccine, for right now, make sure that you're staying safe, okay? Wear your masks, continue to social distance, continue to wash your hands and take every precaution you can to keep from getting the virus, and make sure you get tested very often. You've been listening to Gunshots Straight from the Hip. The views expressed are those of the host and guests and not reflective of any business entity or anyone associated with this broadcast. If you have any comments or want more information on how to be a sponsor, log on to our website at markgunmedia.com or call us at 502-407-0283. That's 502-407-0283. Thank you for listening.
Mark Gun Media. No hype, no hoopla, just damn good work.